Can hypoglycemia cause high blood pressure? Can hypoglycemia cause high blood pressure? There have been some significant studies that have been done that indicate that this is indeed the case. A number of factors have been identified as being potential causes. Among those factors are things such as a history of depression, being female, being diabetic, living with a family member who has high blood pressure, living in an area that is high in salt and obesity, living with an illness such as AIDS or diabetes, having a history of heart disease, and so on. Each person will respond to these conditions differently, but what is important to know is that hypoglycemia, or low blood pressure, can occur with some of these conditions. Blood pressure is simply the force of blood against the walls of blood vessels. When blood pressure is high, the blood vessels begin to expand, which is good for the heart. However, when blood pressure drops, the arteries begin to constrict, which is bad for the heart. Hypoglycemia can increase the risk of hypertension. In addition to these risks, having low blood sugar can also contribute to high blood pressure. Excess insulin can be produced, causing the body to use stored glucose rather than working to create insulin. This allows the body to obtain more glucose than it needs. Hypoglycemia can cause the insulin levels to drop even lower than normal, permitting the body to use stored fat to compensate. When blood sugar levels drop even lower than normal, they can act as an automatic stimulus for the body to produce more insulin, bringing levels right back up to normal. Salt, too, can cause hypertension. When the concentration of salt in your blood rises, it can put too much stress on your blood vessels, particularly your arteries. It can cause a reduction in the amount of blood flow through the arteries. The result can be excess fluid accumulation in your legs, feet and ankles. It can also restrict the amount of oxygen that can reach those tissues, contributing to high blood pressure. People with hypoglycemia should avoid salty foods and drinks. Some of them, such as mustard and salad dressings, contain large amounts of sodium. They should also avoid foods high in potassium, magnesium, phosphorus and calcium, which can also be found in fruits and vegetables. These foods can also cause high blood pressure. For example, studies have shown that high levels of potassium can promote hypertension by interfering with platelet function. While a doctor can make a correct diagnosis of your hypoglycemia, you should always take care to ensure that the symptoms you are experiencing are correct. You can do this by keeping track of your symptoms, especially if they begin to occur more than once or twice per week. If they are consistently present in more than 1 or 2 days, it may be a good idea to speak to your physician. He or she may be able to confirm the diagnosis or put your mind at ease by suggesting a proper diet and exercise regime for you. If can hypoglycemia cause high blood pressure, the answer is as simple as eating right and avoiding those foods that may increase your risk. Click the link in the description to reverse your diabetes.